The world of sexually transmitted infections is constantly evolving, presenting new challenges to healthcare professionals and individuals alike. Did you know that some strains of gonorrhea, a common STI, are now considered superbugs? This isn't just a label, it signifies a serious threat to public health. These superbugs are resistant to multiple antibiotics, making them incredibly difficult to treat. This common STI has evolved, adapting in remarkable ways to resist nearly every antibiotic we've used against it. This resistance isn't just a minor inconvenience, it represents a major setback in our ability to combat this infection effectively. We're facing a situation where our go-to treatments are becoming increasingly ineffective. Gonorrhea's adaptability is a global public health concern, demanding immediate attention and coordinated efforts from healthcare organizations worldwide. The rise of antibiotic-resistant strains threatens to reverse decades of progress in STI control. And this concern is particularly acute, including here in South Africa, where access to healthcare and resources can be limited. The spread of drug-resistant gonorrhea poses a significant challenge to the country's healthcare system. Each incomplete or ineffective treatment, whether due to missed doses or the use of outdated medications, lets the toughest bacteria survive and multiply, strengthening their resistance and making future infections even harder to treat. This creates a vicious cycle that fuels the spread of superbugs. This is evolution in action, a real-time demonstration of how microorganisms adapt and overcome challenges right inside our bodies. It's a constant battle between our immune systems and the ever-evolving pathogens that seek to exploit them. The days of a quick clinic visit and a simple pill, a convenient solution for treating gonorrhea, may be ending, forcing us to rethink our approach to STI treatment and prevention. We need to explore new strategies and develop innovative solutions to stay ahead of this evolving threat. Understanding how gonorrhea spreads, its transmission routes, and the factors that contribute to its persistence and why finishing treatment matters, adhering strictly to prescribed medication regimens, is now more important than ever. It's not just about individual health, it's about protecting the community and preventing the further spread of antibiotic-resistant strains. Let's dive in and learn how to stay one step ahead, equipping ourselves with the knowledge and tools necessary of this resilient infection. By understanding the challenges and embracing proactive measures, we can work together to combat the spread of gonorrhea and protect our communities. Welcome to Health Harbor, your trusted online destination, your source for clear, reliable health information, presented in an accessible and easy-to-understand format. Today, we're tackling gonorrhea, a common yet often misunderstood sexually transmitted infection. It's a topic many avoid discussing openly, but it's crucial that everyone, regardless of background or lifestyle, should understand the facts. Gonorrhea, at its core, is a sexually transmitted infection, or STI, caused by a specific type of bacteria known as Neisseria gonorrhoeae. These microorganisms are the root cause of the infection. These bacteria thrive particularly well in warm, moist areas of the body, making those regions more susceptible to infection. This includes the reproductive tract in both men and women, but also the mouth, throat, where it can manifest as a sore throat, the eyes, leading to conjunctivitis, and the rectum, potentially causing discomfort and other symptoms. Unlike viral infections, which can sometimes linger for extended periods, bacterial infections like gonorrhea can usually be effectively treated and cured with a course of antibiotics, prescribed by a healthcare professional. However, it's important to note that antibiotic resistance is an increasing concern, making early diagnosis and appropriate treatment all the more crucial. Because untreated gonorrhea can lead to a range of serious health problems, particularly affecting reproductive health. Remember, there's absolutely no shame in discussing sexual health with your doctor or a trusted healthcare provider. In fact, being informed and proactive about your sexual health is your best protection against STIs. So, let's break down the key things you need to know about gonorrhea, empowering you to make informed decisions about your health and well-being. So, how exactly does gonorrhea spread from one person to another? It's a crucial question to understand in order to protect yourself and others. Let's break down the transmission process and clarify any misconceptions surrounding it. The primary way gonorrhea spreads is quite simple, through direct sexual contact with someone who is already infected. This highlights the importance of open communication and responsible sexual practices within any intimate relationship. This includes vaginal, anal, or oral sex with an infected person. Any of these activities can facilitate the transmission of the bacteria. It's important to remember that even if you don't see any visible signs of infection, it can still be present and transmissible. The bacteria itself passes most commonly via semen, pre-ejaculate, and vaginal fluids, all of which can carry the bacteria and facilitate its spread during sexual activity. It's important to note that transmission can occur even without ejaculation. The presence of infected fluids is enough for the bacteria to spread. Let's dispel some myths. You absolutely cannot catch it from toilet seats. Nor can you contract gonorrhea from swimming pools or sharing utensils. It requires direct sexual contact. A significant challenge with gonorrhea is that many people have no noticeable symptoms, especially in the early stages of infection. This is why regular STI testing is absolutely essential if you're sexually active. It's the responsible thing to do for yourself and your partners. Testing remains the only definitive way to know for sure whether you're infected with gonorrhea. Don't rely on assumptions. Get tested. It's also critical to understand that pregnant women can pass gonorrhea to their babies during childbirth, which can have serious consequences for the newborn's health. This can lead to serious eye infections in newborns, potentially causing lasting damage if left untreated. Therefore, prevention truly starts with understanding these various transmission routes and taking proactive steps to minimize your risk. Protect yourself, protect your partners, get tested regularly, and use protection like condoms consistently. Gonorrhea symptoms can be obvious or completely absent. In men, look for burning during urination and unusual discharge. Some may have swollen testicles. Many women have no symptoms, or only mild ones like burning urination, increased discharge, or bleeding between periods. These signs are easy to miss, making regular testing vital. Gonorrhea can also infect the rectum and throat, often without symptoms. Don't rely on how you feel. Testing is the only way to know. Diagnosis is simple: a urine sample or swab. Don't guess, get tested and protect your health. Diagnosed with gonorrhea, treatment is essential. Due to resistance, doctors now use dual therapy, an injection plus oral antibiotics. Always finish your medication even if you feel better. Abstain from sex for at least 7 days after treatment and notify recent partners so they can get tested. Partner notification stops the infection from spreading back and forth. A follow-up test ensures the infection is gone. Taking these steps protects you and your community. Untreated gonorrhea can cause serious complications. In women, it can lead to pelvic inflammatory disease, chronic pain, and infertility. In men, it may cause painful epididymitis and rarely infertility. In rare cases, the infection spreads through the bloodstream, causing joint pain, rashes, or even life-threatening conditions. The good news? These are preventable with timely treatment. Use condoms every time you have sex and talk openly with partners about sexual health. Limit your number of partners and get regular STI screenings. Prevention is the smartest way to protect your health. We've covered the rise of gonorrhea superbugs, symptoms, treatment, and prevention. Knowledge is power. Now you can make informed choices for your health. Taking charge of your sexual health is an act of self-respect. Use protection, get tested, and don't hesitate to reach out to healthcare professionals. Every positive choice builds a healthier future. Stay curious, stay informed, and stay healthy. You have the power to protect yourself. Take charge today.